Having tuberculosis can be tough and deadly if not treated in time. Finding the right steps for testing and treatment can feel overwhelming, especially if you're unsure where to start. Back in 2022, Achieve and Pass TB launched CallKaLungs TB Community Hotline to give TB-affected communities a voice to share their experiences and feedback on accessing TB services. The hotline was first launched in 6 regions, gathering 1,043 cases during the period covered by this report. We analyzed the hotline data using the AAAQ framework, a tool that helps identify barriers to healthcare access. Rooted in human rights, AAAQ upholds the right to health as a fundamental part of a decent standard of living. Accessibility means making sure TB services are within safe reach for everyone, physically, economically, and without barriers like stigma or discrimination. Through the hotline, communities reported 588 issues related to service accessibility. 420 out of the 588 accessibility issues are from people who do not know the location of TB facilities and services. Another major concern is the high cost of accessing TB services, from expensive medicines to essential commodities, plus the burden of travel costs that many simply cannot afford. 5% of accessibility issues also show that oftentimes facility hours conflict with patients' personal schedules, making it harder for them to access TB services. Availability means having enough TB medicines, diagnostic services, and healthcare staff to meet patient needs. Reports through CallKaLungs highlight a major concern: shortages and gaps in these essential services. A major concern raised was a stockout of anti-TB medicine from February to August 2024, disrupting treatment for many patients. One report shared that 28 patients were left waiting for enrollment, with some forced to buy their own medicine just to continue treatment. Access to TB diagnosis was disrupted due to critical shortages. GenExpert cartridges, PPD skin tests, and even sputum cups were unavailable, making screening and testing nearly impossible. Patients also reported malfunctioning X-ray machines and shortages in key diagnostic tools. But it's not just supplies. Staff shortages also delay TB care. There were reportedly 10 clients who arrived at health facilities only to find no one available to assist them. One patient even had to wait 2 weeks just to see a doctor. For TB services to be truly accessible, they must be culturally appropriate, gender-sensitive, and ethical. Over this period, CallKaLungs responded to 51 calls related to acceptability. A major concern raised by 51 clients was the adverse reactions to TB medication, ranging from dizziness and nausea to eyesight issues and weakness. Some clients shared that they even stopped taking their TB medicine after experiencing side effects, making treatment adherence even harder. Quality TB care means services must be medically sound, delivered with professional competence, and focused on patient needs. However, 103 clients reported concerns about the quality of TB services, affecting their overall treatment experience. There were also 14 reports on TB medication protocol violations and 17 cases of diagnostic procedure non-compliance. 14 clients also felt that facility staff were unapproachable or dismissive, making it difficult to ask questions about their treatment. 7 clients reported that certain treatment facilities are perceived to have unreasonable turnaround times in providing results or updates and were unresponsive to phone inquiries. Ensuring quality TB care means addressing these concerns. Aside from these AAAQ concerns, stigma and discrimination also create barriers to healthcare access. CallKaLungs has received 24 reports related to stigma and discrimination. Many TB-related stigma cases involve internalized stigma, where individuals feel ashamed of their condition. One business owner, for example, avoided seeking care, fearing that his TB status would harm his livelihood. Stigma also happens in families, workplaces, and even in health facilities. Some individuals have lost their jobs simply because they were presumed to have TB, a clear violation of their right to work. Unfortunately, some of the very people meant to provide care also discriminate. Patients have reported receiving hurtful words and lack of compassion from healthcare providers, making it even harder to seek treatment. Social protection services are also a major concern. Callers frequently ask about financial aid for medical needs, including medication and transportation costs. Mental health concerns also surfaced, with callers experiencing anxiety and depression. Those in need were connected with a CallKaLungs psychologist for support. Although CallKaLungs was primarily intended for TB patients in affected communities, it also received 59 calls from 29 health service providers, mostly nurses from local health centers who sought guidance in conducting drug re-challenges, diagnostics, and treatment management. All these issues call for urgent action to improve TB care from all sectors: government agencies, private sector partners, civil society organizations, and communities. Pass TB and Achieve is keen on working with decision makers at the local and national level to address these concerns and challenges and recommend the following: intensify awareness raising, education and capacity building about TB and TB services. Secure supplies of TB medicines, TB diagnostics, supplies, and equipment. Fully finance the National TB Response. Amend the Comprehensive TB Elimination Act of 2016. With CallKaLungs, we can improve TB care one story at a time. Hi! Magandang umaga! Ito ang CallKaLungs Community Hotline. Ano ang may pigilingkod namin sa'yo?